Hi everyone, my name is Emma Davies and I'm the coordinator of the UK Parkinson's Disease Clinical Studies Group, or CSG, which is funded by Cure Parkinson's. And I'm really pleased to be talking to you today about the group and the work that we do. So what is the CSG? So we're a UK-wide group working to bring more clinical research opportunities to researchers and to people with Parkinson's. And as today's event will be highlighting, research is a really important part of clinical care, but not everyone with Parkinson's gets the opportunity to take part in clinical research. It's a bit of a sort of postcode lottery in terms of some studies. So with funds from Cure Parkinson's, we've been able to set up the CSG, which is working really hard to overcome this problem. And I wanted to just highlight our main goal, which is to further develop and support Parkinson's clinical research across the UK. And our main purpose, which is to make sure that more people with Parkinson's will have the opportunity to participate in clinical trials. I wanted to give a bit of a snapshot of the CSG to date and highlight some of the key milestones and the progress that we're making. And I'll go into some of these points in a bit more detail later in the talk. So the group was launched in April 2022 on World Parkinson's Day. So that was about a year and a half ago now. And since then, we've been building a lot of momentum within our engagement and reach of the group. So to date, we've supported 15 studies through presentations within our meetings to the group members and supported other studies in a variety of different ways. So the group has 50 members and we're continually growing in size. And we have all 18 of the UK Clinical Research Network regions represented by our members, which is really important when sharing the clinical research opportunities across the UK. We hold regular virtual meetings covering a variety of topics, including sharing research information, opportunities, and also best practice. And we support existing schemes and different training opportunities and work to identify gaps which would further improve the workforce. We also have a very active website and Twitter account, which are regularly updated. So who are the members of the group? Because our group really wouldn't exist without our members, and we wouldn't be able to conduct the work that we are doing without them. So Professor Oliver Banman, he's the chair of the group, and there's myself, Emma, who's the coordinator of the group, and we have Professor Camille Carroll and Professor Tom Faultini, who are the co-deputy chairs of the group. And we kind of form the core working group within the larger group of the 50 members. But as many people know, there's lots of different people and professions who are involved in providing care for people with Parkinson's. Therefore, it's a really important ambition of ours to make sure that the group has a really strong representation from a variety of professions. And with each discipline comes a different perspective and expertise. So having all these different people within one place, even if it is virtual, is a real strength of the CSG. So we bring together neurologists, Parkinson's specialist nurses, geriatricians, charity representatives, researchers and managers, GPs, physicians, and people with Parkinson's, which brings me on to my next slide. So one of our key aims is to increase the voice of people with Parkinson's within clinical research. And we have 5 wonderful PPI representative members who are Kathy, Keith, Pam, Richard and Chris. So we hold briefing and debriefing meetings with our PPI members pre and post the regular CSG meetings. The PPI members, they provide their thoughts and feedback about all the different topics that we discuss, and they're really engaged with sort of every activity that the group conducts. So we also hold specific study meetings with the PPI members where researchers can sort of tap into their expertise, run their research by them and discuss different perspectives of how the research is actually going to run, whether it's logistically possible. So that's really beneficial and definitely improves the quality of the research being discussed. And we also share relevant resources, events and opportunities. In terms of our stakeholder representation, these organisations on the slide, they all conduct a really wide range of brilliant work to better the Parkinson's research landscape. And a key role of the CSG is bringing everyone together to synergize our efforts, form effective collaborations, and ensure effective information, resources, and opportunities are shared among everyone, making sure that no one's sort of reinventing the wheel. So just to run through these, we've got representation from Helen Matthews, who represents Cure Parkinson's, David Dexter with Parkinson's UK, Camille Carroll with the NIHR, Mark Edwards, the Association of British Neurologists, Victoria Hornton, the British Geriatric Society, and Lisa Brown, the Parkinson's Disease Nursing Specialist Association. An important aim of ours is to essentially overcome the postcode lottery when it comes to research opportunities. And to do this, we need more Parkinson's professionals engaged and aware of research opportunities across the UK. So since the launch of the group back in April 2022, we've done a lot of engagement and grown in size quite dramatically. So initially we had 10 active members, and now we have 50, which I'm really proud to say. And we've been working really hard to ensure that all the clinical research network regions are represented within the group. So there's 18 of these regions. And again, I'm proud to say that we've got representation from each of those regions within the group now. And the idea is that those representative members can then disseminate out into the regions, and we try and get full coverage of the UK. But we're not being complacent here. We want to keep sort of engaging with more people and fill in any of the gaps that you can kind of see on this map. So I'm going to start calling it an orange star analysis, where we're going to be looking at areas where there are no orange stars, and we want to gain more members into the group to sort of fill this map fully. I should say the orange stars represent members. So we want to keep growing in size and keep getting the full coverage of the UK. So we support a variety of different studies and have had a total of 15 study presentations so far within the regular meetings. And we've got quite a few more studies lined up for future meetings. And presenting these studies within the meetings, it gives a really good opportunity for the investigators to share their research and get other investigators on board in delivering these studies to widen the reach of the research to other sites. And by having more research sites means that we have more opportunities to give these opportunities to people with Parkinson's. And we cover studies involving Parkinson's, multiple system atrophy, progressive supranuclear palsy, and also both the commercial and the non-commercial studies. We also support a wide range of different types of research, so device studies, studies that build our understanding, such as biomarker, so how the disease is characterized, and also diagnostic studies, so ones such as genetic studies, so how we can earlier the diagnosis and then hopefully bring the treatment sooner to people with Parkinson's. And we also support CTIMPs, so clinical trials of investigational medicinal products. And they include both the symptomatic CTIMPs, so studies looking to ease the symptoms of Parkinson's, and also CTIMPs called the neuroprotective ones, the kind of gold star ones that hope to slow or stop the progression of Parkinson's. And on the slide, you can see the long list of different studies that we've been supporting, and some of those might be familiar to you. So a couple of our important aims are raising awareness of training opportunities among researchers and support researchers who are new to research to get involved to build the Parkinson's clinical research workforce. So we've developed the Buddy scheme to deliver these aims, which is essentially an informal collaboration between two research sites or healthcare professionals who are interested in delivering Parkinson's research. And it's open to all sites across the UK. And we share existing training schemes and also look to identify gaps to develop new training schemes. And this is open to all relevant professionals involved in Parkinson's. We want to continue developing this to build a strong workforce across the whole of the UK so that the whole of the UK is able to deliver high quality clinical research for people with Parkinson's. And we're also conducting a lot of other activities as a group. So we have research participant engagement, and we're working with Parkinson's UK, who've developed a toolkit to better stay connected with participants, and we're sharing this best practice with our members. We have a lot of engagement with communities and successful Twitter campaigns, the website that's updated a lot, and also give lots of different presentations within local support groups and awareness days. There's also the professional engagement. So again, we give lots of talks and presentations to try and engage more and more people with Parkinson's research. And also national strategic work. So we're developing a document at the moment to help ensure that clinical trials are costed correctly. But the main take home from this slide is engagement, and we're very keen to engage with lots of different people. Which brings me on to this one, just to encourage you all to please do engage with us. You can follow us on Twitter and access our website. The link's on the slide, or you can email me. So the email on the slide now is my email. And yeah, we'd be really keen to hear from you, and just continue spreading the word and awareness of Parkinson's clinical research.